Hello, everybody. Welcome to our latest episode. Today we're talking about ab separation, so rectus diastasis, or however you want to pronounce it. Lots of people pronounce it differently. We're going to talk about what it is, how do you prevent it, how do you know you have it, how common is it? We're going to talk about how to test it for yourself. And does it come back together without exercise after birth? And then we'll go into fixing it in air bubbles I'm putting up there. Can it be fixed without surgery? We'll talk a little bit about what surgery entails, as we've had a few questions come through on that. And we're going to get a little bit controversial as well, because there's two camps with what you should do with rectus diastasis, or whether you should do anything. So that's what we're covering today. Hope you're excited. Mags and I are always excited, aren't we?
Oh, yes.
Mags is getting more confident with doing this, aren't you? This is probably what, our fourth episode. I'm testing you. I'm pushing your boundaries. So we're going to talk about, so both of us have had ab separation. I'm going to say obviously, because not many people talk about it as a thing that just happens because you are pregnant, and your body is actually adapting to getting bigger in the belly, which is a normal thing for your body to do. So you want to talk about what it is, Mags? We learned it in our safe return to exercise, didn't we? We had to go through that, like, sort of, what do we say? Did you do that rhyme thing that she taught you? Should we say it together? No.
I'm out of practice now.
I know. It's just like testing you, telling everyone that this is raw. You know, it's not edited. We're just talking about what we got through. So you want to go?
Well, we can go together.
Yeah. Okay. So what we're talking about. So your rectus diastasis, or ab separation, is from your obliques. So you've got external obliques and you've got internal obliques on the front, and then you've got your transverse abdominis, which goes from your back all the way around to your front. Yeah. And then as your baby grows, your belly gets bigger and bigger and bigger, and that's when you get this the rectus
linea alba down the middle.
Yeah, that's your connective tissue down the middle, and that's what separates and causes that separation to stay or go back to how it was. Good one.
Yes, we see, encourage each other.
Yeah, exactly.
But part of our brains remember different things.
Yeah, exactly. So it's a natural thing for the body to do. It grows, it accommodates for the belly, your body enlarges with it. I actually had a few of my pregnant mums constantly checking themselves for ab separation during their pregnancy. And for me, I'm just like, why put yourself through that? It makes you feel sad because you're feeling that you're getting separation, but it's going to happen. I don't know what you say about that, but that's my point of view. So some of this is questions have asked. We actually had a lot of questions come through for ab separation. How do you prevent it is one of them. Well, there's a few things you can do. Get to a healthy weight through your pregnancy, focus on posture stuff throughout your pregnancy, breathing, doing things like rolling on your side when getting up rather than hoiking yourself up straight up, not straining while you lift things like heavy shopping bags and things. Have you got any more, Mags?
Look, to be honest, because I got it again after the second pregnancy, and I focused a lot on breathing. I was doing everything by the book, but I could see 20 weeks in, when I started to get the bump, that I was getting the doming again. So it was really interesting because I had 2 centimeters back after my first child, and then it was just like as if it just kind of came open again. So look, I think preventing it is a real challenge, to be honest. I think everything you've said of, like, obviously when you get up out of the bed, get up off the couch, get up off everything, always roll to your side because you want to put that pressure on the front of your core area.
Yeah, definitely. And how do you know if you have it, was another question we got. So lots of things. If you've got it after giving birth, it's like a bulge or a pooch, your belly protrudes, like Mags was saying, doming, coning, when you sort of lean up and you'll see that your tummy comes to a little peak, and that's what we call doming or coning. Struggle lifting objects like walking, performing just general tasks, painful sex being one of them. I was looking up some more of these and this is what came up. Pelvic or hip pain, lower back pain is a key indicator, but it may not indicate the fact that you have rectus diastasis. This may just be that postpartum you're having lower back pain, so it is really key to figure out why you're getting the lower back pain. Poor posture, which is a key one. We're all hunching forward, breastfeeding, aren't we? Lifting up things. Constipation could be another link. And just generally feeling weak or sort of jelly-like in your tummy area could be an indication. Did you get any of those sensations, Mags? I think I got all of them.
I had quite a few after my first child, because I ended up with like I could fit a fist and a finger, so they like weighed it up as like a 6 centimeter gap. I was offered surgery, but I refused it because I'd gone through enough. And then I got it back to 2 centimeter gap, and the depth was okay. So they kind of just said to me, it's fine. And normally that's what they say, that it comes back in. It was about a 2 finger. But yeah, I had extremely bad lower back pain, and I always looked pregnant because it was really prominent in my stomach, that gap between you. So, and like, I suppose, as I say to people, it's like zipping up a jacket and it just bursts in that middle part, you know.
That's what I talk about corset like. Abs.
So yeah, the lower back pain, but this time round I knew what I was doing. I've just gone in and just done strength work with it straight away. So
brilliant. We're actually going to talk about what Mags is doing, because it's handy. She's like 15 weeks postpartum, so listeners are going to get to hear what Mags has been up to for her recovery, which is amazing. Just so people know, we're actually going to talk about how you can test yourself, and what we're talking about with like fingers separate, like the depth and the width. Because then we're empowering you to find out for yourself if you have that, and then you know what to do with that information. They say that 2 centimeters or less is normal, and you're told to seek help if more than 2 centimeters, or you have symptoms like I was talking about just before with the lower back and the pelvic floor and the doming. Now, for me, I think if you have 4 centimeters ab separation, but you feel good, you're not getting any of these symptoms, then do you need to do anything? Like, for me personally, I think if you're functioning well, you don't have any pain, do you need to shrink that gap for any reason? What are your thoughts, Mags?
Well, I suppose after the second baby there, I've had the 4.5 centimeter. I haven't had any issues, but more, I think, really, to be honest, it's more of an appearance thing. You do still look like you're pregnant, you know. You do see that that protruding area, I suppose, there. So for me, it's more of like an oh my God, my brain. Like, it's a visual, I can get away with it now.
Exactly.
You know, that people
it's the aesthetics, isn't it?
Yeah, that's the word I'm looking for.
Okay,
Yes,
cool.
Yes, yeah.
100%. We all want to look good.
Yeah, so it's more that, like, I'm able to function okay with it, but I don't like the look of that area, if you get what I mean. And you know, there's so many people that don't like the look of that area. And yeah, that's what more for me, it's more that than it is I'm struggling strength wise, if you get what I mean.
Yeah, amazing. And that's great. I think it's key for people to have that sort of understanding, like if you're functioning well, even if you're looking good and you're happy with the appearance, but you still have that ab separation, just think about whether you feel like you do need to close that gap or not. Max is going to talk to you about how to test yourself for this ab separation, because we want everyone to feel empowered. And so if you're listening, you could actually do it now. So Max is going to talk to you. So you can, for me, I need to do as I hear, otherwise it won't stay.
So I just say to people, you know, come to the floor for me, but come to the floor kneeling and then roll basically onto your side. Because if you do have the ab separation, I don't like you just to literally go straight onto the floor. So roll over onto the side. So straight away you're protecting that area. And then I get you to lie flat and literally just completely zone out. And then I get you to slowly, you know, bring your knees up towards your bum, and then basically like a sit up, you know, just sit up for me, lifting your shoulders off the ground. And then I literally just start walking my fingers down. So I start from my belly button down. I'm actually doing this on myself here.
Yeah, me
down. And then I travel up, and then I just go, because you have to go quite, for me, because I've had bigger babies, I have a lot of loose skin there. So I actually have to go in that bit deeper and feel it. And you can actually feel either side of your linea alba of has it separated. And then I literally squeeze in how many fingers I can feel in there. And then I get people to completely relax down. And then you can actually check it on a relaxing, see what it's like. Then I get people to literally engage their core for me and see how much of a depth that you have then when you have engaged, and then again relax everything and do it without engagement. So it shows when you have that engagement what strength is in there as well. So yeah, that's how I test it, and then just completely relax down again. Yeah.
Okay. So it's like, do you test for 3 separate areas? Below the belly button,
Yeah,
just above the belly button, and then just bit higher?
A bit higher, because for me, I actually have it higher and I have it lower. I'm actually grand in the middle. It's just, which is just so random, but that's the way mine is. And it's actually more up the top than it is down the bottom for me. Yeah.
Okay.
Below the belly button. Yeah.
And that's key to know as well, because it will help you understand how to train that person. Because you're obviously going to do something different, aren't you? Because you want to focus on your areas that are showing gaps or
And then I think as well, it's like, don't overthink it as well, because a lot of people put a strain in their neck to get up and have a look and, you know, all that kind of stuff. But just totally just relax, you know, try not tense up the body, really relaxed. And, you know, if it is bigger, then you seek help. Yeah.
Yeah. Okay. So they literally come up, put fingers in between 3 areas of their belly button, 3 areas of their tummy, sorry, lower part, just above the belly button and higher. And then they can feel separately. So they can do that. They can come up and test one area and come down, and then come up again and retest. And then you can just record it, like the depth and the width. And then from that, you can then go and seek help if you wish. If you're not functioning at your best and you don't like how your tummy looks, then go find a personal trainer who trains mums, who specializes in returning to exercise, because there's not a lot of trainers who specialize in working with mums specifically. Definitely go and see a pelvic floor specialist if you haven't seen anyone yet. We always rate the physios to go and see.
And I think as well, look, I don't want to put down anyone here, because that's not who I am as a person, but sometimes trainers think when they've had a baby that they're qualified then on pre and postnatal. And you know, for me myself, here I've had 2 different pregnancies, and you know, total different level of like they're being so different, the 2 of them, that, you know, like what I've learned from my first pregnancy to my second pregnancy, I have all this education behind me. I just didn't have the baby and be like, oh, well, I got my body back. This is grand. I know what I'm doing. You know, I have all this education. And It's not putting anyone down. It's just there's a massive window in the pre and postnatal training, that it isn't just because you've had a baby that you don't that you're qualified to have train people, train moms. Oh my god.
I love that you said that, because I was exactly the same, and I've only learnt this stuff since having my son. I didn't know straight away how to heal my body after. I didn't know what ab separation was. I didn't know about pelvic floor apart from Kegels. It's learning it as I go. So now this second pregnancy, like you said, I feel a lot more confident in knowing how to train myself straight away after giving birth, compared to just Googling shitloads of stuff after Monty and being like, oh, I never knew that was a thing. Cool. Let me look into that, and going down this rabbit hole and seeking all these different professionals and then finding what works for you. It's just a minefield. So really important. Yes, definitely. Seek someone who's actually certified in working with postpartum mothers. Question here. How can it be fixed without surgery? Let's talk about fixing it, actually, because here we'll go into what you have done, which would be amazing. But first it says, does it come back together without exercise after birth? And short answer is yes, a lot of it can, but long answer is everyone's different. So some people, it may come back together without doing anything. And other people may need work. Other people may be functioning with that gap. So many things could be going on, and it's just unique to that person. So I guess it's going to seeing a pelvic floor physio or a postpartum PT. Do you agree with that?
Yeah, definitely. Yeah.
Easy. That's a good answer. Let's talk about fixing it. Can we fix it?
Sound like Bob the Builder.
Yes, we can. Bob the Builder. Good job. This is the mums listening into this, right? So to prevent making it worse, someone's asked. Now, I've got a few things that we mentioned before, like avoid the standard thing on Google, right? It says avoid lifting anything heavier than your baby. Okay, right, impossible. Okay. Roll onto your side when getting out of bed or sitting up. Use your arms to push yourself up. Well, yeah, you can get used to doing that. Skip activities and movements that push your abdominals outward, like crunches and sit-ups. Now, Mags and I listened to a podcast, last week? Mags actually shared it with me.
Yeah.
Anthony Lowe, who's this physio detective, some people may know him, Australian guy. He is this guru in rectus diastases, really passionate about mums recovering. And he talks about, he actually gets people with rectus diastasis to do weighted crunches. And he believes in strength training and doing things weighted for your core is key to healing it and to functioning at your best. So doing it with load and doing functional movements. Now, the other camp, which I find a lot of on Google, is the standard response of, and what we got trained in our pregnancy course, postpartum course, was isolate your TA, your transverse abdominis, and isolate your pelvic floor and learn how to use them together to do certain core exercises to help you strengthen from the inside out. I don't know about you, Mags, but I talk to my clients about the inner core unit. So those 4 areas of the multifidus, which is the spine for listeners, the pelvic floor, the TA, the transverse abdominis, and your diaphragm. So they're all part of your inner core unit, and often gets neglected and missed because it's not the aesthetics, it's not the outside, it's not the obliques, it's not the things that you're going to see ripped six-pack abs. It's the stuff that's going to help you function and not be in pain. So we've got one side, Anthony Lowe, who's like tested us and it's like, well, this is a guru in rectus diastasis who's telling us that you should use weighted load for rectus diastasis and stuff, and then the stuff that we're trained in, and you find, and it's isolating the TA in the pelvic floor. So we're going to talk about that because we're always learning, Mags and I, and we're always open to everything, which is why we wanted to share it with you today. We didn't want to just gloss over the fact that we've just heard this new information. Mags, what are you doing right now with your exercises to build yourself up, and what do you think about what Anthony Lowe said?
Look, I agree with some of the stuff he said, because like I was taken back first because I was like, wow, like you've been told so much not to do, but really when you're in the real world, which we are, we have to do stuff. We have to lift capsules, we have to lift buggies, we have to do things around the house. We we can't pay cleaners to come in and do all this for us. We literally have to just get on with life. No. And I just think for me it's and I know Anthony Lowe as well said about like not kind of telling you what to do, of like what muscle to engage or that kind of stuff, where I go against that, because I think and personally, I'm a very hands-on trainer with all my clients. And, I always say to them, I'm very hands-on. I want them to know what muscle I want them to use and stuff. Because a lot of people don't use the muscle, like it's a real training the brain. Yeah. So basically for me, I had a C-section this time round. And 2 weeks after my C-section, I started doing just literally breathing exercises. So I focused on that. And then 4 weeks in, then I started doing some movement. Obviously from a C-section, scar is quite tender, so there was no going crazy for it. But then for me, because I knew I had the separation, I knew I had all that going on. Obviously someone else wouldn't have known it until 6 weeks checkup or whatever, whenever they find out. But for me, I didn't actually lift the capsule for 6 weeks. I was lucky that I literally walked to the school for my child, because I didn't drive. A lot of women, everyone kept saying to me, just drive, it's okay, you can drive. But I was like, nah, I'm following the rules, I'm doing this. So I walked everywhere. And obviously when you're walking, you need to use your core, and I really do believe that helped my recovery. So I didn't heavy lift. All I lifted was the child, which was 4.45 kilos. So that was it. And then slowly started building myself up. Then 6 weeks came, and I was lifting the capsule around the house, and then I just had to literally get on with it. I was driving and I was lifting the capsule, but I had my body strong before I was not strong, but it was functioning before that. And then literally I've just gone on and did more isolated exercises. And then I had my women's health physio checkup, and then we went through different things. And then I literally started adding in weights and movement. So for me, I believe that we need to train it in functioning, like when we're functioning. Oh my God. So excuse me, we know what you mean. Total baby brain. So I do a lot of and I suppose as well, as I said earlier, like it's really about building that foundation first, and knowing and having yourself supported. So really having that core switched on before you lift anything or you do anything. And as well with diastasis recti, it's recommended no rotation. But if you go to grab your older kid or whatever that's running away from you, you're going to move to grab that child. Yeah. And if you aren't training yourself in that plane, you're going to injure yourself straight away. So I believe that we need to train ourselves in all our different planes of motion, because we need to always be alert to do, like say lifting a bag of shopping, or I found I did a lot was literally just chug the capsule under my arm. I have the other kid hanging off me, and then I have a bag of shopping. Do you know what I mean? So, and then I've rectus, oh my God, diastasis recti. And yeah, so basically building that up in all different planes. But then obviously isolating it as well. Like I say, after I did a strength training session, I'd do isolated work on it then as well separately. And just judging my body and going from there.
Yeah, nice. Listeners wouldn't have seen, but Mags's son just came in and just hanging off her shoulder. So listeners, yes, we're all here doing our podcast. We're still in real life too.
School holidays. I can't wait till he goes back. I love him dearly, but oh my goodness.
It's harder work, isn't it? Some people think, oh, school holidays cool, and they've got no routine and stuff, but it's actually harder because you have to ferry them around all day. So what I'm hearing you say is probably similar to what my take is as well, is that doing both, like helping people be aware of your TA and your pelvic floor, because so many mums postpartum are like, everything's just soft and jelly. I have no idea what you're talking about. So how are we meant to just get them into strength training if they're not aware of what they should be feeling in their body? Is important. And then doing the strength training, the functional stuff that Anthony Lowe's talking about, adding load, which I agree with, because how you build strength and muscle is load. I think the main thing that's come out of this is that it is focusing on posture work, breathing, and strength training to help with anything that's going on with your core and pelvic floor.
We want to cover like just a bit of breathing with people to understand what I'm on about when I did breathing exercises after having the baby.
What did you think of Anthony Lowe when he was talking about how people call it diaphragmatic breathing? I kind of laughed because it's so true. Because Anthony Lowe says that oh, I hate this thing called diaphragmatic breathing. It's like, you are breathing, you're using your diaphragm because you're breathing. And it's like, well, yeah, that's true, actually. Why are we calling it that? And I guess he says it's explaining it to your client or to whoever in a better way, rather than saying it's diaphragmatic breathing. It's like, no, I want you to breathe a different pattern in your body rather than up in the chest constantly. Is the restriction. So
I think as well, a lot of people hold their breath.
Yes.
So, I think for me, I always talk a lot about the breathing because, and I was one of those people that held my breath. Yep. So like, you don't have to teach people how to breathe, but it is just giving them the tools to have that. So basically I just say to people, like, when we inhale, we want to just totally relax everything, every single thing inside in our body, we want to relax. And I always say to people, just inhale into your back. So then you're taking it, because majority of women, we breathe into our chest, where we want to take away from that. So when we breathe into our back, we're filling up our back, we're filling up the whole area, filling up, belly, chest, everything, but we're filling it up evenly rather than just breathing into the chest. Or I see a lot of people that just breathe into their belly, but then obviously if you've muscle separation, you're breathing into your belly, you're protruding that, separation. So it's really even out your breathing. And I just say to people, lie on the floor and put your hand on your upper back, so you can feel that your back is pressing into the ground as you breathe. And then when you exhale, you want to start by lifting up your pelvic floor. And then, like, for all the word, like a rolling pin. So you're lifting up your pelvic floor, you're switching on your transverse abdominis, and you're rolling that rolling pin all the way up your belly for all the world. And that's switching on your whole entire core, from the working from the inside out all the way up. Because a lot of people do it is they suck in at the belly button, and then again, that's not helping your muscle separation. So what you call it, you really want to focus on that breathing all the way from up, and then you want to release that all back down again. So basically, I kind of say to people, when you let go of that pelvic floor, you want to like pretend you're making a fart. So you're literally letting go of that and then relaxing everything on the ground, and then take it again nice and slow, exhale, bringing everything up. and then down again, because you don't want to do it fast. And the more slower and controlled you are, the more muscles you're engaging. I personally feel, someone else might disagree with me, but if you do it fast, your brain hasn't even switched on of which part I'm working with. Where if you do it nice and slow, you're engaging that body a lot better.
Yeah.
And it's worked for me. So I keep going with it. Yeah.
Definitely. Again, similar to how I've trained people, and this helps mums just feel calm anyway. You come into the that gym environment and you're a mum, you're just thinking about all the things that you've just had to put aside for this time for yourself, and just to get them to breathe. I just did it myself as you were telling me, and it just instantly feel calmer just taking that deeper breath. Sometimes I get people to lie in child's pose, and then I just place my hands at the base of their back if they're struggling, and ask them to push my hands away as they breathe in, just so they can start linking things. But yeah, super important, like you say, just to help them be aware. And I like the analogy of your rolling pin. I use a corset, so you're doing your corset up from your pelvic floor, doing it up, and then you're undoing it, to try and get something, an analogy for people to visualize their best, don't you? And I keep changing it up and trying to see what works for people.
And everyone has a different, but even engaging your pelvic floor, like
what does that mean?
They're like, I'll never look at raspberries again, but I'm like, just pretend you're picking up raspberries with your vagina. And they're like, no, Max, I really like raspberries.
Like,
till you said
I can't eat raspberries anymore. Yeah. I think Kylie Rankin, the pelvic floor physio, explains it as an octopus. So she does that, and it's just like you're picking something up. So loads of things, whatever works for that person to actually get it in their head and help.
Yeah.
Funny. I can't eat raspberries anymore now, Mags. Thanks. Another question is, okay, we're coming to the end of this. Someone asked about surgery. What would it entail? Have you had an experience with going down the surgery route? Do you know much about it?
Look, when they had a chat with me that time about having surgery, literally it was really short and sweet, but he was like, what we do is we literally take out your belly button, we stitch you back together, and then we pop your belly button back in. And I was like, okay, cool, thanks.
Wow.
So, and look, you know, I kind of say it as well, like for me, surgery, obviously I had the other surgery with everything else, but in that area, you know, like if you're going on to have another child, it's going to stretch again. So really is surgery. And at the time I didn't know that I want to have another child or anything. At the time I didn't, but I was like, you know, I didn't want to go down that route. But are you strengthening that area? Are you just pulling skin back together? Do you know what I mean? So that's kind of the thing as well. I personally don't like surgery, because it's like, are you actually strengthening that? Are you going to do work on it? Or is it just going to be, you're going to have the everything pulled back together and then it looks pretty, but what's the inside like, do you know?
Yeah, definitely. I'm in agreement with you. I did a little bit of research just because I had a listener, a question through for that, and they asked about it, and I found that the surgery is to sew the abdominal muscles back together after pregnancy, and it used to be covered on Medicare, but it was removed in 2016 after concerns of it being misused for cosmetic purposes only. And normally it happens doing a tummy tuck, they say. Most patients, if you do the surgery route, most patients experience 2 to 4 weeks of acute recovery following a diastasis recti repair, although swelling can persist for up to 6 weeks, and full recovery can actually take up to a year or more. Drains will be removed after 2 weeks, and a compression garment will be worn for 3 to 4 weeks. So just for that person who asked the question, or anyone else who's looking down the surgery route, there's just a few things to help you understand that it's not just surgery and then things bounce back. You're going to have to do seems like you're going to have to do a full rehab anyway, which in our opinion is you might as well do that and see if it helps anyway before you go down the surgery. And we're not saying don't do surgery or do surgery, it's your choice, but we're just going to inform you that what it entails, and what you can and can't do. What else have you got on ab separation that you think our listeners need to know before we wrap it up?
I suppose, look, what I found really good after I had Rory was basically I don't know if people have heard of them, the SRC, or is it SCR? The supportive shorts from the health.
Yeah.
I
think they're SCR.
SCR. Yeah, you can they're quite expensive.
Sorry.
They're quite expensive, but I found they were really good for support. And I suppose because I had the C-section as well, that all supported me and kind of glued me together for all the world.
Yes.
I couldn't get into them because they're really compressed.
Right.
For 2 weeks afterwards, I bought these ones from Kmart that are compression. They're in the underwear and bra section in Kmart.
Yeah.
And I wore them for the first 2 weeks, but I found getting in and out of bed the first couple of weeks after, even while you're in hospital, having that extra support was good for that area. So if anyone feels when they're pregnant that they've got that doming area or coning, that just have these as a backup in your bag, and then just pop them on because they give you that extra support. Yeah. Or if people do feel conscious of that area, they're really good as well for literally holding you together under your clothes as well.
Yeah, nice. Actually, that was recommended by my physio as well as like a first point of call once you are postpartum, having those compression shorts. And I've heard mixed reviews, but then when I heard it from her to say no, there's a lot of reviews to say compression shorts are great to have postpartum. So I will be investing in some of those, which will be good fun.
Well, I'm finding them really good now for running. Like I wear them all the time for running, and I have to say there's a big difference if I don't wear them.
Nice.
While running. And they're oh god, the brand, I've got 2 pairs of leggings as well that have that so basically it's like a thicker oh my god, band around your tummy area just to protect. I think they're called postnatal support. I can't remember. I can give you all the
we'll have a look and we'll put it in the
up.
links for people.
And I wear them as well, and they're just basically just giving you that extra support as well, because the first couple of weeks it's everything is quite sore, and just dealing with everything and lifting the baby and stuff, that it's nice just to have mom protected.
I guess it feels nicer, doesn't it? Nothing's like loose and uncomfortable. It's just like, okay, I'm focusing here, my tummy is compressed and it's comfortable. I can imagine it being a comfort thing as well.
Yeah, definitely. Yeah.
Okay, amazing. So it seems like focusing on what's going on with your body is key. Knowing if you have ab separation or not. Is it important? I mean, Anthony Lowe again says, do we need to know if you have rectus diastasis? So again, I think his thing is very much about, you're not broken, you're just weak. And I think both of us are in agreement. We don't want mums to think, I've got this dreaded rectus diastasis or pelvic floor issues, I'm damaged goods, I've got lower back issues, and people have told me that it's just because I'm postpartum and I have to put up with it forever now because I'm a mum. No, that's just not the case. You can always improve things in your body when you start focusing on the right things for you. And it can be fixed years later. You can improve things years later. It doesn't just have to be straight away. So if you're listening to this and worried because you're like 8, 9, 10, 20 years postpartum, there's always something you can work on. So figuring out what's going on with your body, and potentially hiring someone who's going to help you, at least at the first part, so you start becoming aware and empowered about what works for your body, and then you can go it alone and get on with things and know that you're doing the right thing for your body. Posture work, breathing, and doing things that help you move with your children in everyday life rather than feeling restricted. and like, oh no, I can't go back to running anymore because I'm postpartum, or I can't go back to lifting weights. Whatever you do and whatever you love doing, there's no reason why you can't do that again just because you're postpartum. I think
but don't as well, I suppose, that if you do have bad back pain, or if you have pain in areas, don't just do the exercise because you're doing the exercise. You want to enjoy exercise, and you want the exercise to make you feel better. And if an exercise is making you feel like
yes,
you don't do that exercise,
yes.
Seek help. And if you feel, look, I've spoken to so many different professionals. Everyone has different opinions. So if you feel that first opinion isn't working for you, go get a second opinion, third, fourth, fifth. It doesn't matter. You have to feel empowered in your body and know what's going on with your body, and ask as many questions as possible. And as well, I suppose for me, and my last note is, please don't be sucking in your belly. A lot of people, just the minute you start talking to people, it's
I won't breathe.
Just breathe. It's okay. We all have bellies. We all have loose skin. We bloody have carried these big babies inside us. Our skin has stretched. It's going to take time to come back together. If someone's listening to this and they thought they had diastasis recti, they've checked themselves and they don't, please don't beat yourself up. A baby's taken a long time to grow in there, and it'll take time to come back as again.
Yes, definitely. And as we always say, 6 weeks is nowhere near long enough to give yourself time to recover from something massive that's happened to your body. There's evidence even talking about how it should be 2 years postpartum, which makes sense to me, because that's the time it gets for your body to get back into balance with hormones and muscle changes, and even for your organs to move back into place. I mean, they'd be pushed up into your throat like this whole time with this baby. Give it time. That's this for us. For those who were listening and had questions, we are actually going to cover in another episode, because we had a lot of questions around tummy fat and loose skin. So Mags and I are going to do another episode on that to cover all of your questions there as well. As always, please let us know what you think. You can do voice notes in the podcast here, and you can write us a little review. We're on Apple now. That would be lovely to hear from you, hear what you think. And please share with other mums that you think might benefit from us prattling on. We're updating episodes every week. So thanks a lot. Bye.
Thanks, everyone. Bye.